Sorry, I had to take a little break. My Screencastify wasn't working or wasn't going any further than a half an hour, so I had to start another video. So this is part two of week three, and we were talking a little bit about the ASCA national model, and the four important components are assess, deliver, define, and manage. And so you're going to do all those things, and there's many different tasks that you need to do underneath each of those words. Define is you're going to be using your ASCA mindsets and behaviors and your professional standards that we just talked about. You're also going to have a program mission. You're going to have a program vision. Those are the things that are under define your program. Then you're going to assess, find out again your program assessment, where are you at in regards to doing all the components of the national model. You're going to always use your school counselor assessment tool that we'll talk about in a couple weeks, because it's really important that you are following along and doing what a school counselor should be doing and not just doing things that you want to be doing. The deliver is direct student services and indirect student services. You want to spend most of your time doing direct student services with small groups, classroom, or individual, or you want to be working directly with parents or with teachers. Your indirect student services are going to be collaboration. They're going to be working with agencies, things like that. And then you always are going to be managing your program focus and your program planning. That's going to be your school calendar. It's going to be how you manage your time, and there's a lot of more information under each one of those, but we're just going to hit on that real briefly for tonight. So we talked a little bit about this also last week, but you also need to make sure that your programs that you're using, your interventions, are outcome researched and evidence-based. And so the definition of efficacy is when you talk about efficacy, you're talking about something that's being effective and doing what it's supposed to do. So you want to make sure that you're choosing programs, school counseling interventions and programs that are doing what they're supposed to do. You don't want to just guess that they're going to make students more successful in their achievement. You want to make sure that you're doing interventions that are hopefully kind of tried and true. And they're not always going to work because you're working with students, but you want to make sure that you are using things that are evidence-based. And it's really, really important for school counselors to use that efficacy in the choosing of their programs and their interventions. Because after you get your needs assessment done, you're going to determine, what are your priorities for your school counseling program, and you need to make sure it's efficient. You don't want to, you're going to try certain things, and some will work and some won't, but you want to make sure that you are trying programs that are evidence-based. You want to make sure that they can, are hopefully going to be successful. Then there are programs and curriculums that, have gone and that have that research-based background. You need to make sure that you're hitting the three domains: the academic, career, and social and emotional programs that are considered evidence-based because of strong outcomes, helping to ensure your work effectively supports success for all students. And a lot of times those your programs are going to go right in with others, all school programs such as PBIS and RTI. PBIS is positive behavior intervention supports, and RTI is response to intervention. And those are different levels. And we're going to talk a little bit about the different levels and tiers for your school counseling program. So these are, again, those same three links that I shared last week on Center for School Counseling Outcome Research and Evaluation, What Works Clearinghouse, and then the SAMSHA National Registry. This is more social, emotional, and mental health and substance abuse programs and practices that are proven successful. These three links, if you want to look and see which programs are research-based, this is the place that you want to go, and they'll have the information for that. These are some really good examples of programs that you might use in your programs, and these are research-based. The first lot of some of them cost money, some of them cost more than others, and there are some free ones. So the EverFi resources, this is a really good program. What it does is um, it's no cost, it's totally free, and it does a lot of financial literacy, which I know in Iowa, the legislation did have a mandate that all students need to have a financial literacy class, but now I think they might have taken that away. But these are really good lessons that you can use in some of your school counseling programs or in maybe some other areas of your curriculum in different curriculums, but a lot about money skills. They also have different things on drug safety for high school students. They have lessons for all the different levels, and they're all um, electronic, they're digital lessons, and I know we've used some of the financial literacy ones, and those are actually pretty good. The Character Strong, Cedar Falls High School used Character Strong for their advisory time, their SEL lessons. I think that Character Strong is really positive. They give lessons and they give you exactly, what you need to say. You can also get a little bit creative and not follow along exactly, but to really, use the basics so that you cover, the important standards and things like that. But it's a lot of teachers you're going to find, and I think some of you share this in the first week, that a lot, if you're doing SEL lessons already, sometimes your teachers aren't going to buy in too much because, especially at the secondary level, some of the teachers don't feel like social emotional lessons are their responsibility. So you need to make sure and get creative. But this Character Strong is something that I think is really, really positive. And there's a lot of topics in there. It is, pretty expensive, but there's a lot of topics. There are a lot of lessons that you can use them just as they are in the scope and sequence, or you can pick and choose some of those. So Character Strong is a really good one. Zello, this is another program that Cedar Falls High School used. And in Iowa and in many states, you actually, all students had to have what's called a 4-year plan or an individualized plan. And so Zello is something that can help work with your students on doing some career assessments. There's so many different things in the Zello. There's a course planner where it can take care of your tracking your classes, making sure you're meeting your requirements. There's college planning where you can do a lot of exploration for different colleges. When you're applying your senior year, you can keep track of colleges, things like that. There is also, whoops, I lost the Matchmaker, which is awesome because you can do what is your personality, what are your likes, what are your dislikes, your interests, and there's then they'll also come up with different careers that maybe fit with your career, your likes and dislikes and your interests, and so that's always fun to do with students because sometimes it's like, yeah, that fits, that's right on, and sometimes it's like, no way, there's nothing in that I really want to do in my future. But there's just all kinds of ways that you can help students do exploration for careers, for college, keeping track of things. You can do a resume on here. You can do all kinds of surveys and different things for individual planning. So Zello is something, it does cost money, but it is a really, really good program. And then Second Step, I'm not as familiar with Second Step, but that program, I know a lot of elementary students use that for, they use it, for social skills and teaching students different social emotional skills. And so that one, there is a cost to it, but they also do have a high school level program available. And again, I'm not as familiar with Second Step, but I know a lot of schools do use that. And then the last one is CASEL. This is the collaborative for academic, social, and emotional learning. And I know some of you are familiar with the CASEL, and there's tons of information in the CASEL too about different guidelines, different standards that you can use for some of the different areas. And it's just a really good website to share, how to implement. They have webinars for training and all that kind of stuff, professional services. I'm pretty sure you can just go on Castle and it's free, but I think there's also some options where you can pay and maybe get a little bit more. But I know Castle has all the different, standards in it that you're talking about for social emotional learning. So it's a really, really good program to use. And these are all, again, evidence-based, research-based. So those are just a few of the examples that you might want to start looking at for your school counselor core curriculum. And again, you don't have to follow along step by step, but you can get a little bit creative and put some other things in there. So you're implementing your school counselor Common Core standards. Every student gets everything. So make sure two of the questions that you're going to ask is, to what degree do you currently utilize standards in your school counseling classroom lessons? And then how can you ensure the incorporation of standards throughout your school counseling curriculum? How do you make sure all students get what you are presenting to them? And this is from the School Counselor's Guide to Multi-Tiered Systems of Support. It's just a little bit different than what they talked about in the Hatch and Heartline book, but it's the national Ask a National model aligned with the multi-tiered systems of support. And so tier 1 is where direct and indirect prevention for all. This is all school counseling lessons, any large group, any school-wide activities that you do for assemblies, or you might do some transition things. It's also going to talk about student appraisal and advisement, any kind of testing. It's also going to give parent groups, parent meetings, things like that, any community partnerships that you have. Tier 1 is going to be what all students get, what all parents get. Tier 2 is going to be direct and indirect services for some. These are going to be students that need a little bit more. They have individual or small group counseling. There's going to be instruction, appraisal, and advisement. If they need a little bit more, we're going to talk about 504 plans that some students might have to have a 504 plan. They're going to be identified through some of the activities that you do in tier 1 because they need a little bit more. And this is going to be the school counselor consulting and collaborating with teachers, staff, parents, and community providers. And then tier 3 is the indirect services for few. Your tier 3 is going to be the few students that really need some more intensive support. And that's going to be chronic. They're going to have more complex needs. You're going to need help consulting and collaborating with other agencies. They might be wraparound support that you have to get treatment services for a student, things like that. But your multi-system of support also needs to align with your school counseling programs. So it needs to incorporate collaboration, leadership, advocacy, and systematic change. You need to define, manage, deliver, and assess all the different things with your program. So this is just another example of the multi-tiered system of supports. And then in the book, Hatch and Heartline talked about 2 different models. The first one is the 4 tiers. The first one, again, is what every student gets just because they breathe. Tier 2 is going to be intentional school counseling responsive services. That might be small groups, that may be students who are failing classes. You need to give them some study skills or some organizational skill, and you do that in a small group, or you might do some individual counseling. Tier 3 is going to be, again, that more targeted students who really need some intensive services. And tier 4 might be a referral to an outside service that, again, treatment services for somebody with a substance or substance abuse addiction, or maybe, having mental health counseling in your, a lot of schools now have mental health counselors that come to their school. So that's going to be that tier 3 or 4 that are going to be referrals to resources outside of the school counseling program, but you're going to refer those. And then the diagram on the other side, again, it talks about how you keep those 3 domains: academic, college, career, and social emotional, in with all the different tiers. So all the students get the district core curriculum, they get individual student planning, that would be using something like Zello, and they get district and school-wide activities. The tier 2 is going to be for some of the students. You're going to use data, like how many students are failing classes, how many students are missing school. You're going to do some small group individual referrals for resources, and you're going to consult and collaborate for that. And then your few on top in the tier 3 is going to be referrals, or it also might be like an IEP or a 504 plan. It also might be a referral to like an alternative school or something that students need even more intense help than what a school counseling or the normal school can give a student. So there's different tiers that you need to be very aware of. And so when you're choosing what you want to cover in your school counseling curriculum, you need to make sure you're following the criteria that's going to help you determine again what is in the standards for the mindsets and behaviors, or for CASEL. You're going to make sure that you collaborate with teachers. You don't have to do it all. School counselors can only do so much, but you can collaborate. I know we collaborated a lot in the high school level with health teachers. We also collaborated a lot with English teachers because every student had to take English classes. So we tried to make sure that some of our standards could fit in with English classes or with health classes. Counselors do need to do some lessons, but they don't need to do all of them. You need to make sure that you're including the individual planning, the 4-year plans, and then in Hatch and Heartline book in chapter 1, there's a ton of examples on the curriculum scope and sequence charts, because you want to make sure you're covering every single guideline or every single standard in between K through 12. And sometimes you have to work with your different levels. If you're a K-12 counselor, you're going to be able to do this all by yourself. But if you are working in just one level, you're going to have to work with the other people in your district. And there's a great example of a scope and sequence template that you can use to make sure, again, you cover grade level, lesson content, what domain, ask a domain or mindsets and behavior standards it covers. You're going to talk about the curriculum and materials, when the project starts and ends, because you want to make sure that it all aligns together, especially like if you're going from 8th grade to 9th grade, you want to make sure that what they cover, aligns pretty good for not, because you might want to, some of the standards will be repeated, but you want to make sure that your timing is good for that. And then how are you going to evaluate? So this is just a scope and sequence template that's in those links at the for the different additional resources in the Hatch and Heartline book. So then chapter 2 of the Hatch and Heartline book, intentional school counseling, because some kids need a little bit more. So what's the difference between responsive services and intentional school counseling services? You're always going to have to respond to students. Like when you have something that happens in your school, a suicide, obviously you're going to respond and do what needs to be done. If you have a student whose parent dies, or a student who might be sick, you're always going to be responding to the students who come in and share those things that have happened to them. But you also want to make sure that you're doing intentional school counseling. You're looking at the data and making sure that you're helping to identify students who need that little extra, again, through achievement, through through attendance, and through behavior. And you're going to be looking all the time what students are always in the same, always maybe absent, or maybe the students that are failing classes, things like that. So you're always going to be looking at data and figuring out what are some intentional school counseling services that I can give a smaller group of students that need a little bit more. And one of the things that Trish Hatch talks about a lot, she says that school counselors should not be spending 90% of their time with 10% of the students. It's not the philosophy of intentional guidance, and it's not that you don't work with those 10% of students, but you find maybe more intense services that can help them. But you need to also make sure that you are spending your time with the other 90% as well. So again, this is how you determine what students need that tier 2 services. Students that might not be achieving or attending, you're going to look at academic attendance and discipline. You are going to target those students because you will have specific small groups that you want to bring about some change in their attitudes, in their knowledge, and their skills. You want to intentionally look for these students. Level 2 interventions might be small groups, individual counseling interventions. Level 3 is going to be more intense interventions, could be treatment, could be mental health counseling, it could be alternative schools. things like that. And like I said earlier, spending 90% of the school counselor's time with 10% of the students is not the philosophy of the intentional school counseling program. And so you need to make sure you have intentional acts of school counseling, not always random. You're always going to have random school counseling acts that you do, but you want to make sure that you're looking for students who need that help. You're never just sitting around, again, waiting for students to come to you. So the model of evidence-based school practice and counseling practice is number one, what's your problem description? What is your area that needs to be addressed? Number two, use that outcome research. Know what's likely to work. And number three, intervention evaluation. Did it work or not? You need to make sure you have interventions and assessments in place to see if they work. So one of the things that school counselors are a lot of times in charge of are 504 plans, not so much special education IEPs. If you're not been in a school, an IEP is an individual education plan. These are Iowa terms, and other states have similar terms to those. But 504 plans are a federal implementation that students can use. But the IEPs, special education, those have different ways that you get an IEP than 504. So I wanted to talk a little bit about these because these are going to be your either your tier 2 or 3 students. That if students need special education, this is an act that most of the time you have a special ed person in your building that is going to be in charge of doing the collecting data and making sure, because there's very strict guidelines. There's a lot of funding that goes, federal, state, and local funding that goes into this. And so students have to start and go through a very specialized process to determine if they actually need an IEP or not. School counselors are not always involved in identifying students for special education, but sometimes they might be a little bit involved because you might be doing like maybe a small group on organizational skills or something like that to see if that's helpful. So the special education, again, you have to have parent consent. You need to make sure parents are involved in every step of the way. Students can have an IEP birth through age 21. And you have to have an evaluation, and then you have to have meetings once or twice a year. So that's an IEP or a special education student. A Section 504 plan is something a little bit different, and this is a Civil Rights Act. You usually have a Section 504 coordinator, which a lot of times school counselors might be a coordinator. The funding is local. A lot of times there's not a lot of funding for that. Usually the 504 plan will just provide accommodations for students. We're going to talk about subsamples for that. It might be a physical or mental impairment that just needs accommodations. Maybe it doesn't need as much intense services as an IEP. It does not require evidence that the disability adversely affects the student's educational performance, but you just might need a few accommodations. And coverage can actually be all ages. Parents should be involved. I don't know why you wouldn't want parents involved, but it's not as required as the IEP. And then notice to parents is required. And you do go through a little bit of a process for a Section 504 plan as you do for the IEP, but it's not quite as detailed. So if you are in charge of 504 plans, which again, we're going to talk about that. Sometimes school counselors, there can be a lot of pluses with those, knowing who those students are. You need to know who your students are with 504 plans. You need to know who your students are with IEPs. And you need to make sure that if you are in charge of 504 plans, you also can provide students with accommodations for especially ACT testing, PSAT testing, AP testing, things like that. Because that's probably one of the main accommodations is extra time for testing. And it can be for anxiety, it can be for, different things, ADHD, it can be for different things that students might need a little extra time for. Sometimes it might be testing in a different location. You might need a computer for writing tasks, including like ACT, essay. It might, some other accommodations for a 504 plan might be that students sit in certain places in the classroom. It might be you look at their schedule and you have more of the core classes in the morning and maybe a little bit more of a break towards the end of the day. Or sometimes students might need extra breaks if they have, ADD or something like that, or, if they have a lot of anxiety, you might put an accommodation for some extra breaks. So most of the 504 plans that we worked with high school students had to do with a few of them exited from IEP, didn't need as an intense service, but they still needed accommodations. And the accommodations just, when students have a 504 plan, it puts a little bit of legal teeth into the accommodations. Also, it might be if students have some anxiety, depression. I know I had a family that actually had 2 students with the Ehlers-Danlos syndrome, and this is where students they get fatigued easily. Their muscles get fatigued, and so they had to have a 504 plan so that if they were doing any kind of testing that filled in the dots, somebody had to fill in the dots for them, or they needed extra time for testing, or if it was any kind of a essay test, they could do it on the computer. So those are just some examples of 504 plan accommodations. Like I said, the eligibility, accommodation, and services, it's a process. It's not something that a parent can just come in and say, I want a 504 plan for my student. You need to make sure and go through the process of, the special ed is very detailed and very specific. The 504 plan, you need to also collect some data and figure out what kind of accommodations are going to work and what kind of accommodations, and then do a testing period, and then make sure that it's specific to their needs. So I thought this was a good picture too. So all students within your district is the outside blue circle, and then you're going to have students with impairments. Not every student with impairment needs a 504 plan or IEP, but sometimes you will have students who need 504 plans, and sometimes with the more severe impairments, you're going to have students with the IEPs or the IDEA. So if this is something that becomes your job to identify, evaluate, and place students with 504 plans, you need to make sure, again, that there's specific steps that you follow. There's a process. Every school district should have a process written down that you follow, and that you always have a committee, you get parent input, you get teacher input, you get student input depending on the grade level. But you gather your committee, you figure out what is the problem, what is going to help. You're going to gather data from the student, you're going to gather data from all other areas like your grades, things like that. And then you're going to make sure that those accommodations that you have set up, that they actually work, and then you can implement the 504 plan. But you always have to review and reevaluate a 504 plan, just like an IEP. So it's not something that a student gets in their freshman year and they don't, that nobody ever looks at again until they're a senior. You need to evaluate and reevaluate at least once or twice a year. So if you are in charge of 504 plans, make sure you know that it's always a team effort. It's not just you making a decision saying yes or no. Make sure you get training if this is your responsibility. Know the process to advocate for students. Sometimes I always felt like students whose parents advocated for 504 plans, it was helpful for them, but there was a lot of students who maybe didn't qualify for IEPs that could have used 504 plans, but they didn't have their parents advocating. And then it becomes your job as a school counselor to advocate for a 504 plan for them. And just remember that anytime students have 504 plans or IEPs, it's not a sign of weakness. It's just getting them on that level playing field. And it's also something that they don't always want publicized. So you need to make sure and keep that very confidential with students, and that teachers know that students have 504 plans and IEPs, but it's not something that they also tell the whole class. So ASCA does have some position statements on several different topics. They do have a position statement on the school counselor and students with disabilities. And this would be something that would be really good for you to look at. It's on their website. This is just the download of all the PDFs. But look there's so many different topics on different areas. And these are position statements that the ASCA group has taken a position on certain things. So students with disabilities, there's one that it actually talks about, it really doesn't recommend that the school counselor is in charge of 504 plans, but that you know those students and making sure that they're getting the accommodations that they need. So it's usually